Okay, we're gonna go through joint classifications today. Welcome back to Eat My Shorts, and we're gonna do structural classification and functional classification of joints because there's two different kinds. Synovial joints, cartilaginous joints, and fibrous joints make up the structurals, and functional synarthrosis, amphiarthrosis, and diarthrosis. Okay, now synarthrosis would be the least mobile, amphiarthrosis semi-mobile, diarthrosis is the most mobile. And let's get to it. So we're gonna go through there's fibrous joints and the gomphosis. Gomp is teeth. So it's the teeth. And then the sutures are in the skull. Now, did you know they have ligaments, sutural ligaments? There you go. This suture here is called the lambdoid, which is between temporal and occipital. And they don't move a whole lot, so those sutures are fibrous joints, and they're also synarthrosis joints because they do not move. They're very immobile. Okay, let's go to amphiarthrosis, and this is a symphysis joint of intervertebral disc, which is a amphiarthrosis. Now, if you remember, amphiarthrosis is that semi-mobile, and you think about the spine is semi-mobile because they kind of go together like a stack. And have you seen the best example is a wooden snake, where it has all these links and it just kind of goes like that. If you can imagine, if I had a wooden snake, guys, spent like $1 at Walmart, I would have a wooden snake, and you can see what I'm talking about. But that is a semi-mobile joint. Another amphiarthrosis would be these interosseous membranes of, well, the one in the wrist for supination and pronation, okay, is a semi-mobile joint. It's really a joint, but it's a membrane that just exists between the radius and ulna. Now, you have that same type of interosseous membrane between tibia and fibula. However, this does not move very much at all, if at all. It's very immobile, but this would be a syndesmosis. A syndesmosis would be like the interosseous membrane. Okay. Now let's look at some synchondrosis. So cartilage is chondrosis, and like bone to cartilage. Now this epiphyseal plate, growth plate. You ever hear of a growth plate for young children? That's where the bone grows. It slowly morphs from cartilage to bone, and that's where growth plates are. And we're gonna go to another one, synchondrosis, which would be between the ribs and the sternum. Is a place where you have cartilage meeting bone. Okay, costochondral junction. Cost, I believe, is rib, and then chondro is cartilage, and it's the junction between the rib and the cartilage junction. And so a lot of this is cartilage, a lot of all these rib bones, and whenever you have a skeleton, you know, it's fully decomposed, that cartilage just kind of falls away, and this is really what you're left with. All that white stuff, cartilage, goes bye-bye over the course of time. But I wanted to go through diarthrosis. Now, diarthrosis is the most mobile joint that you have, and those are synovial joints. So all of your diarthrosis joints are synovial joints, and synovial meaning they have a synovial membrane, and it creates synovial fluid. Okay, that membrane produces fluid for lubrication of the joint, allowing it to move freely. So my shoulder would not be able to do this without synovial fluid. It would hurt like crazy. When somebody has a lot of arthritis, that bone puffs out. If you ever seen anyone with arthritis, it puffs up like popcorn, and there's all these air pockets in the joint. Over time, the synovial membrane and the cartilage in between that joint starts to kind of break down. There's not enough space for that fluid to move, and it hurts so much. So a lot of these patients with bad knees, oh, my arthritis is acting up, that kind of stuff. You just don't have enough fluid, and you imagine two bricks just rubbing together. That's pretty much what their joints kind of look like. Or pumice stones, I should say, rubbing together. But these diarthrosis synovial joints, you have axial, biaxial, and multi-axial joints. Now, I'm going to go over some of those real quick. We have a pivot joint, which is atlantoaxial, so the atlas and axis, where you say no, that is a pivot joint. It just pivots around the dens of the axis and just goes back and forth just like that. That would be a diarthrosis. Now the saddle joint is really in the fingers. Really, the thumb is a good example. A plane joint, I guess they're pointing at the ones in the ankle, which makes sense. Ball and socket. Now, ball and socket joints are what you're gonna have at the hips and the shoulder, the glenoid cavity and complex here. That is the ball and socket. Hip is another ball and socket, and ball and socket joints are the most mobile joints that you have. That's also why they're the most prone to injury. So the more mobile it is, the easier it is to injure. At the wrist, they're talking about these chondroid joint, like that. Condyle, okay, we didn't really go over those in my class, but sure, why not? High and by, high and by, and then the hinge joint of the knee and the elbow. So that would be where it just goes in that one direction. That's it. These are all synovial joints. To my knowledge, they all have synovial fluid. They are all diarthrosis joints. Okay, so diarthrosis is a synovial joint, and they can move in all these different ways. These are their structural classifications. Structural classifications, and this is the way that they move: uniaxial, biaxial, and multiaxial. So if it's uniaxial, it's only moving in one plane. That would be a hinge joint. Biaxial would be this one, where it's high and by. Okay, that's all you can do. Saddle joints are kind of the same way, but there is a multi-axial motion that you can mimic with these biaxial joints. It's not actually like a ball and socket rotation. So this would be rotation. This is what we actually call rotation. But when you have a biaxial joint, even like the finger and these saddle joints of the finger, you can make a little circular motion. What you're doing is you are combining this and this and doing it all at once, and it looks like rotation but it's not, and we call that circumduction. Okay, but this multi-axial joints are the ones that actually rotate around. Okay, I think I've pretty much covered most of it. Let's go to the lever classifications. So this is where your physics class and your anatomy class are really going to combine, where you have a class 1 lever system where the effort is on one side, and that would be the muscle. The load is on the other side, and the pivot point or the fulcrum is in the middle. Now, effort in this case is coming from the neck muscles. You're going to make that nice yes motion because you're a yes man, and the fulcrum would be at the axis, the bone, and it's going to pivot at that fulcrum up and down, and the load is your chin. This is the load. Here's the effort in the back of your neck. The load is out here, the weight of your head and chin, and the fulcrum's here in the middle. And so that's what makes this a class 1. And to my knowledge, this is the only class 1 lever system in the body. Class 2 is like a wheelbarrow, okay? The wheel is where you have the fulcrum, the load is in the middle, and the effort is, say, the calf muscle here. So they have a great example of this. There's the wheel, the load is the weight of your body, the effort is happening in the back, just like you're picking up on a wheelbarrow. Now, to my knowledge, this is the only one in the entire body. And what we've done at class 1 is the most efficient, class 2 is a little less efficient than class 1, and then class 3 is the least efficient way to have any kind of lever system, and that is every other joint in the entire body. So all the rest of your joints are class 3 levers. For example, the weight of my forearm would be the load, all of that weight, okay? The fulcrum is my elbow, but the bicep is actually going to attach down here, okay? Fulcrum is here where the crease is. The load, or the effort, is going to happen here. Load is out there. There's all the weight. Here's this little tendon right here, and it's going to pull from that point past the fulcrum and try to lift the load. All of the rest of your joints are going to do that. So, yeah, that about covers it, and I hope this was helpful. See you guys.